Hello viewers, welcome to another series of Proud Professionals. Today we have a great personality with us. She is Dr. Indu Bansal. She is the Director, Radiation Oncology with Narayana Super Specialty Hospital, Gurugram. She in total brings to us around 21 years of postgraduate experience within the oncology space. She has been with various hospitals like Rajiv Gandhi Cancer Hospital, Paras Hospital, Artemis, Max, and we can keep going and naming all of them. I would like to introduce her. Hello, doctor. How are you?
Hello. How are you doing?
Thanks. Dr. Indu, actually, I'm really inquisitive to know that since we talked about your journey with so many hospitals, how have you seen the oncology space evolve? Because it is really nice to know that we are talking about cancer in nowadays, terminology. So, how's your journey been?
So I think I would say that it has been a very, very gratifying experience, I must say, since I joined my radiation oncology degree. That was in 1996, and now the branch has really grown. We have a lot of new centers coming up, and I think we have very good centers of excellence. And now I can very proudly say that we have the best of cancer facilities, and we have everything that is available in the best of centers. And that is why we see so many patients traveling from far and abroad who come down to Gurugram for taking their treatment. And so the survival rates of the patients has definitely gone up. The quality of life of patients has definitely improved. And patients are now living longer and happier even with cancer.
Oh, that's nice. Actually, just wanted to know that you specialize into radiation oncology.
Yeah.
So, what is radiation oncology? If you could just give a brief to our viewers about it.
So, I think that's a very good question, because for patients, whenever we are treating patients with cancer, there are basically three modalities which are used. One is surgery, which everyone is aware of, wherein you remove the part of the tumor which is affected by cancer. And second is a medical oncology, wherein you give drugs either through the intravenous line, like you give administered glucose, or you give oral pills, or you give targeted therapy to treat cancer cells. And third modality is radiation oncology, wherein you focus X-ray beams, high energy X-ray beams, or in some centers they treat patients with cobalt, or you give some radioactive isotopes to kill the cancer cells. So it is a highly focused treatment, and these days we have excellent technology to focus radiation only on the tumor and to spare all the normal structures from side effects of radiation.
So it's a way of treatment is what we are doing.
Yes, it is.
So actually we like to know how has your journey been, because I'm sure you've been totally involved, having a doctor's lifestyle is a very hectic lifestyle. So how has your journey been within this space? If you could just brief our viewers about it.
So I would say that it has been, as I said before also, it has been a very gratifying and fulfilling journey. So in 2004, I resigned from a very reputed hospital to take care of my kids. And I started practicing in Gurugram. That was in 2005. And at that time, there was no oncology set up in Gurugram, though no center which was treating cancer patients. So that way, I started my practice in Gurugram, and I had to start with medical oncology practice because there was no radiation oncology. But then I joined Batra Hospital in 2007-8. And then I worked at various hospitals, and now I'm looking after radiation department at Narayana Super Specialty Hospital. So I would say that the branch has tremendously grown, and we have the best of treatments available. So it has been a very, very fulfilling journey, and I think I'm still a learner. Every day I'm learning something new. And because the branch is evolving so fast, that it's very, very important for me to keep pace with what is happening, not just in India, but anywhere else in the world as well.
So, ma'am, another question, because you've talked, and cancer, as we all understand, is very depressing when somebody just hears whether it's your own person in the family or somebody else. So I'm sure you see so many cases every day, and you've seen the ups and downs within the whole life of a patient. Anything that really touches your heart, or anything that you felt was a memorable kind of a case, or you still feel that, anything that you would like to share with our viewers about a patient or an incident?
I think the most important thing which touches me is when a poor patient walks in my OPD whom I can cure, but just because of lack of funds, or because of ignorance, or because of lack of knowledge about the advancements, they are not able to give treatment to the patient, and they go for desi nuskas or Ayurvedic treatments or homeopathic treatments or so many things, just because they think that cancer is a death sentence and the patient can't be treated. So if a patient I can cure and that patient goes out of my OPD because of lack of money or lack of ignorance, then that's something which takes my sleep away. So, and the second thing that touches me is when patients put their immense faith in you and they believe that you are the only person who can do something for them. I remember I had a patient who had come to me way back in 2007 when I was in Paris hospital, and he was diagnosed with a stage 4 disease, and practically he was told by everyone that there is no cure. And that was 6 in the evening, and I said that I can't do anything for you. But the patient sat down in my OPD and said that I don't know, you will have to cure me, whatever you do, whatever you want to do. And you won't believe, that night I could not sleep. I talked to all my superiors and teachers, and I asked them if there is something I could do for the patient, and everyone said no. And next day in the morning when the patient came to me, my mind was thinking of some other medicine and my pen was writing something else. And you won't believe that for that patient even I had not imagined that he will live. But just because he had an immense faith in me, God guided me, and I wrote something which was completely not in my mind. And that was 2007, and it is now 2019. And for these many years, the patient is still alive and kicking.
Oh, that's nice.
So, if the patients have faith in us, they have trust in us, then we always want to go a little extra mile and do something for them. So, I think that's very important for us, and every day is a big learning experience.
Oh, that's nice, and I think the blessings that they give you, I'm sure, are much more higher. And that reminds me, actually, you in a discussion that we had prior to this interview, you did mention that you are helping a lot of patients free of cost, and I think it's a noble thing. So how do you look at it, and how did this whole journey start?
So as I said that now at least the things are changing, but earlier, even now, cancer word, the C word, it's like a death sentence for most of the patients, even if we know that we can cure them. But the moment they come to know that so many patients who come to us, they are very young, they are the bread earners of their family, and they are from very poor socioeconomic strata, and they don't go and stand in the queue of government hospitals. So what I try to do is that because there are so many professionals whom I know and who are ready to help, so sometimes I send my patients to government setups, and there they take care of them. And thankfully now I'm working in Narayana Super Specialty Hospital, which is the brainchild of Dr. Devi Shetty, whom everyone knows is the renowned cardiothoracic surgeon. And he has told me, you won't believe, the day I joined Narayana Super Specialty Hospital, the first word that he said was, no patient should walk out of NH gate because of lack of money. So thankfully here in this hospital, I have the permission to give treatment even at a lower cost for the patients who can't afford treatment. So many NGOs are also trying to help, and at times, at least what I can do is I don't charge them my OPD fees, I lower the packages, and at times certain pharma companies also give us some money to help them. So that is how we try to help patients, or we can guide them to the right place where they can take treatment in a minimal cost.
Oh, that's nice. That's nice. And I think we should keep this up, because definitely the society needs that thing. One thing that I'd like to know is, how do you feel, sitting back, if you have to kind of throw back and think of your 21 years, like how proud are you about being a doctor, end of the day?
I think being a doctor is the most fulfilling thing that has happened in my life. I don't even think I could have been anything else, because my patients are my best teachers. Every patient that walks in my OPD, I'm learning something new from them. And I think that talking to my patients is in a way therapeutic for me rather than stressful, because when we see them fighting with cancer, then now I've started believing that any problem is easy. So I always feel let the problems come from anywhere, but let the solutions come from me. So I think every day I have to read every day I'm trying to go a little extra mile, maybe in my words of kindness to them, in the way I deal with them, or every day I learn how they are fighting. Even the caregivers, nobody looks about their pain, but the way they leave their jobs, they take out money and then they take care of their patients. So every patient teaches us something or the other.
And, just an inquisitive question, do you see difference between a female patient and a male patient? I'm sorry, but the reactions, are they different?
Oh, definitely. Definitely, I would say, but now I would say things are changing. Earlier, when any patient would come to my OPD, female patients, the family would not even take their opinion, what they want. Like a female patient, her breast would be chopped off, even if we could preserve the breast, and nobody would ask her what she really wants. And so the patient's attendants are made to sit outside the OPD, and it's the family who's taking decision. I think that's an absolutely wrong way of doing that. But if the same thing is happening with a male patient, then male patients are more or less a part of decision making. But now I'm seeing more and more females, and it's not necessary that they might be working, they might be homemakers, but still they are taking their own decisions. And I must say that there's a difference between Indian patients and international patients. So when I see patients from African part of the world, then those females, they are such strong women and they take their own decisions as compared to the male patients, I must say.
Okay. And doctor, because you've been such into this space and having that hectic lifestyle, whom do you think has been your greatest support, or the person who's been standing behind you always? Anything that you would like to talk about?
So there are so many of them, but I think the first and foremost that stands out is my husband, Dr. Narayana Aggarwal, is a physician. He has been my rock pillar. He has always been there in whatever I've been doing. I've been out of house for many years and with small kids at home. But I think if he was not there, I would not have done anything. I would have been lost in the crowd. My children, Anmol and Mansi, they are my pillars. My father, my mother, my brothers, my in-laws. And these are the family members, and I have some bunch of very good friends whom I can talk to and or call anytime. But there are certain people in oncology as well whom I really want to give credit. One is Dr. Nagar, the managing director of Paras Hospital. He believed in me when nobody else did. So I think he deserves a big round of applause from my side.
Behind every successful person, you will have a lot of people, and in your field, definitely you will need that kind of support. So that's nice to hear. Anything that you'd like to talk about, your life mantra? I think
I think what I feel is that you can achieve anything in your life if you have your good work ethic, unstoppable spirit, and if you stop looking at other people and stop comparing themselves from other people. Every day what I think is that I have to be a better version of myself than I was even a minute before. So I think I have to give my 100%, and I have to. The difference between ordinary and extraordinary is that little extra mile. So I think if we do just a little extra for every patient that walks in, and we always think that what is in there for him rather than what is in there for me, then I think that makes all the difference. So if what I can do for the other person, if I focus more on that rather than thinking what will I gain from it, I think that's what keeps me going.
Well, that's nice. Thanks, Dr. Indu. It was really nice talking to you, and I'm sure viewers, you've really enjoyed the discussion. Dr. Indu has really talked about a lot of things from the society, the extra mile, the support that she's got. I think we all need to encourage and embrace cancer patients. Definitely the caretakers, as she mentioned, are a critical part. Thanks, Dr. Indu, for your inspirational talk.
Thank you for inviting me here. It was a good experience talking to you, and I just want all my patients to live life with a smile.
Thanks, Dr. Indu. And keep watching Radio Dwarka and our series of Proud Professionals. Radio Dwarka, a step towards tomorrow.